let's move on to the next part, which is basically abstracts. And all those abstracts were taken out of the most recent SOHO meeting. So why don't we start with the first one? And here we are talking about multilineage responses in patients who were enrolled on the COMMANDS trial. And I think these were somewhat observations that were sort of driven by the investigators. And I believe Dr. Garcia-Manero was the very first to report the fact that luspatercept can actually improve neutrophils and platelet count in patients who have lower risk disease. So along that vein, this is the very first abstract that we would like to comment on. And here, essentially, the results seem to suggest that luspatercept certainly led to demonstrable improvement in erythroid, neutrophil, and platelet lineages, which supports its use in patients who are ESA-naïve and transfusion-dependent low-risk MDS. But I'm curious, when you guys looked at the abstracts, what were some of the thoughts that went through your mind?
Yeah, this is something we see in some of our patients. Of course, we have, those, sort of kind of SF3B1 mutated patients where only one line of cells, the red blood cells and the hemoglobin are depressed. But we have other patients and patients with, other mutations or other mutational spectra that have other cell lines that are suppressed as well. And this is something that we've seen in clinical practice where when we give luspatercept, we actually see some improvements in the ANC and the platelet count as well. And so this was good because it kind of formally looked at that. It did show that luspatercept was probably as good and probably better than ESAs at improving the blood counts in some patients. And so you have to think that could, in individual patients, achieve some additional some added benefit. It kind of suggests that maybe this TGF beta inhibition is important in some other cell line populations, either in maturation or maybe even in the stem cell population, and not just the erythroid lineage.
Yeah, and I would agree with that. I think, it's tough. This particular study was a pretty small subset of patients. The numbers that they were looking at, were not statistically significant, when we looked at the small cohorts, so numerically better. And I think it's something that we are all interested in hoping will be the case where, we also can see, in addition to anemia benefit, neutrophil and platelet benefit. But, personally, just reviewing this abstract, I do think we need a little bit more real world data and a little bit of a larger patient population before we can start thinking about utilizing this drug, for patients, primarily for, low platelets or low neutrophils, or even in patients that have, significant cytopenias that would, require certain therapies otherwise.
Yeah, I think you both covered the abstract. Well, there isn't much more to add, but other than to just say that indeed, again, it's a small number of patients, and really only about 8% of the patients in COMMANDS trial had a concomitant neutropenia. Only about 14% had a thrombocytopenia. And you're getting improvement in these patients, but you're getting improvement in about a third of them. So again, not everyone's responding, but I guess for that MDS patient that has, some mild neutropenia along with a low platelet, you have some additional support here that using luspatercept will potentially impact that as well.
I'm actually happy to see that it impacts it in a positive trend as opposed to a negative trend, right? Because you want the hemoglobin to improve, but you don't want to give patients other cytopenias, nevertheless. So stable or improved is always a welcome.
Yeah. And I think, our other options, right, in these, bicytopenia or pancytopenic patients are HMAs. So anytime we can, delay the need for utilization of an HMA in a patient that is neutropenic and thrombocytopenic and sort of get away with using, luspatercept first and not affecting their blood count and saving for an HMA for a later line therapy is a big win. So.
Totally agree.